Good afternoon.
Good afternoon.
All right, you're welcome to our Essential Medicines CHCHT 254 lectures. As usual, we'll continue with our presentation for our CA. Without wasting time, I want to call on Energy and Chinwendu. Is she here? Come out. Your questions are as follows. What are analgesics? Then list 10 analgesics in the Nigeria Essential Medicines list. Then discuss the pharmacology of any of the analgesics listed above. Your time starts now.
Good afternoon, my fellow students.
Good afternoon. Come closer so I capture your voice. Okay?
What are analgesics? Analgesics are drugs that selectively inhibit the perception of pain in the body. This means that these analgesics now it is taken to reduce any sensation of pain in the body. Analgesics are drugs that are being taken to reduce pain, so it is also known as a painkiller. There are different types of analgesics, and analgesics now are grouped into three. We have nicotine analgesics, non-nicotine analgesics, then anti-inflammatory analgesics. 10 analgesics in Nigerian Essential Medicine. We have diclofenac, ibuprofen, acetylsalicylic acid, acetaminophen, pentazocine, Novalgine, Anagine, Fentanyl, Indomethacin, and there are others. Then discuss the pharmacology of any analgesics listed above. So I will be discussing on ibuprofen. Ibuprofen, the brand name is Brufen.
Is what?
Brufen.
Brufen. Is it in Nigerian market?
Yes.
You've seen it in Nigerian market? Brufen. Spell it.
B-R-U-F-E-N.
Right on the board. Fast. Brufen, okay.
This ibuprofen now belongs to anti-inflammatory drug. It reduces pain as well as inflammation. The mode of action of ibuprofen, it suppresses pain by inhibiting the prostaglandin synthesis. This prostaglandin synthesis is the mediator of pain in the body. So this ibuprofen suppresses the pain there. It reduces inflammatory. It induces sweating, which evaporates, thereby producing a cooling effect and lowers the body temperature. Indication: mild and moderate pain, dysmenorrhea, which is painful menstruation, migraine is a kind of a headache, a severe headache, low back pain, fever and pain in children, sore throat, because when you have sore throat you feel pain, so if you take ibuprofen it reduces the pain. Then dosage: 1 tablet twice a day for an adult. Then for a child who weighs 5 kg, 50 mg 3 to 4 times daily. 6 months to 1 year child, 50 mg 3 to 4 times daily. 1 to 3 years, 100 mg 3 times daily. 4 to 6 years, 150 mg 3 times daily. 7 to 5 years, 200 mg 3 times daily. 10 to 12 years, 300 mg 3 times daily. Then route of administration: it is taken orally. Then dosage form: it comes in tablet, suspension, and capsule. Side effects: nausea, vomiting, heartburn, anorexia, which is loss of appetite, abdominal pain, rash, fluid retention, blurred vision, you will not be seeing clearly. Then contraindication: than those that are not to take the drug. Acute and renal dysfunction, peptic ulcer, lactation, that is a mother that is breastfeeding a child. Then those people that are hypersensitivity to ibuprofen. Then this ibuprofen, if you are giving it to a patient, if you are giving this drug to a patient, advise the patient to take the drug with enough water and also should take enough milk. And don't give this drug to any person who fall into the contraindication which I've just mentioned earlier. So thanks. And again, it has its strength. You have the one of 100 mg tablet, 200 mg tablet, 400 mg tablet, 600 mg, 800 mg tablet, 200 mg capsule, 100 mg per 5 ml oral suspension, 50 mg per 1.25 ml oral suspension. Thanks.
What are the dosage for? Okay, you mentioned the dosage form.
Capsule, tablet.
You made mention of adult. You said adults should take one tablet. Is it a good way to say to talk about drug dosing? Is it by tablet or to be specific on the strength or the amount the patient should take? Because if you say one tablet can mean what? 100 milligram. True of us, it can mean 200 milligram. I think you specific for an adult. What milligram would the adult take?
I think 400 mg.
400 mg. Twice daily, right? Or 3 times a day, depending.
Yes.
Please, let's clap for her, please. Is that all you can do? No, this one is weak. It's weak. Put energy. Thank you. God bless you. This is how presentation should look like. Straight to the point, no long story. Hit it, and go your way. Hit it. Don't muggle up what? Things. Are we together? Hit it and go your way. All right. Thank you very much. 003, right? Sorry, 004, sorry. Okay, who is Nwanne former Christabel? 002. All right. So the question for you is, explain the objective of the National Essential Drugs Program, NEDP.
Good afternoon, everyone.
Good afternoon.
The objectives of National Essential Drugs Program: to make essential drugs available to the entire population on a condition basis. We all know that essential drugs are those drugs that satisfy the majority of the population. So the work of this NEDP, that is National Essential Drugs Program, their work is to make the drugs available at all times, to use drugs that are safe and effective. They make sure that the drugs we are using are safe for our health and also effective. To promote training for improved drugs management and skills to health workers. They are trained health workers and also improve skill to them. To reduce the cost of drugs through bulk purchasing system using generic name instead of brand name. They reduce the cost of drugs whenever you purchase a drug using generic name, it is less expensive instead of using brand name. To save life and improve health by ensuring the quality, safety and the rational use of drugs, reduction in the level of fake drugs in the market. Like this NEDP, they reduce the rate of which fake drugs circulate in the market. To promote essential drugs concept and mechanism, and also promote standard treatment guidelines. They promote a drug concept and the treatment guideline for drugs. They supply essential medicine to all levels of healthcare, like both the federal, the state, and the local level. They supply all the essential drugs that they are needed. They help to encourage local manufacture of drugs. They promote safe prescribing and safe dispensing, thereby preventing medication mistake and errors. They promote how to prescribe drugs, and in that situation, preventing medication error.
Is that all? When they ask a question like this, I think the best thing we have to start from is try to say one or two things about what what. We try to say one or two things, because the question says the what objectives. You start from what is even NEDP? Why is it established? So just one paragraph is okay about NEDP. Am I communicating?
Yes.
Good. Then, because you can't just jump boom and start saying they do. What you are saying is hanging. Try to talk about what NEDP is, what, and from your introduction would give the person or the examiner or the person reading your work an idea, or the person listening to you an idea of what this body is supposed to do. Am I communicating? Before you now talk about these things you mentioned now. Am I communicating? You may mention of standard treatment guideline. Did you bother to find out what is standard treatment guideline all about? Did you bother to, because if you are working, there's what is called division of terms, true of us. If you are working on a topic and you come across, you should be able to say one or two things about any time you are doing what you use, true of us. If you are doing a presentation now and you talk about maybe as you're presenting, you mention a standard treatment guideline, and somebody in the audience will just say, "Hey, excuse me, please, what is standard?" You say, "I don't know." How does it sound? Do you understand where I'm going to? Can you tell us one or two things about standard, just treatment guideline? Do you know anything about it at all?
So, like, if I may say, that standard treatment guideline, like, if a drug is supposed to be taken daily or per every 4 hours,
Okay.
or and the duration in which a patient is supposed to take the drug.
Does anyone know anything about standard treatment guideline? Anything about it at all? Anybody? Does anyone know anything about standard treatment guideline? After this class, try to. You can go online. You can see whether you can. There's a book available to Nigerians. A standard treatment guideline. There you see it's a general thing anyway. is sometimes you may not follow it exactly the way it is, but it's a general thing that approve maybe treatment of different diseases in Nigeria. What and what is recommended apart from normal official book we use, the one maybe that has names of drug and what they treat. That one is different. This one is purely medical. It's medically inclined about different diseases localized, obtainable in our what environment. Diseases, most of these diseases, and the what and what you can use in what. In fact, prescribers, health professionals, mainly prescribers and healthcare professionals use this alongside other what, use this standard treatment guidelines for Nigeria alongside other reference books in what. So try to look it up. I used to have it. I used to have a photocopied one, but I don't know who took it from me. It is available. It's a very nice book. Just once. It's not even that big. Just you can look for it. You can buy it and have it. It's very important. You have it as your watch, handbag. Okay. So that's what standard treatment guideline is. I don't want to go into rational, but you should know rational drug use because you researched it, two of us. So let me give you a secret to successful presentation and research. If you are doing a research, don't pick a word or a phrase you don't understand and put in your work. Am I communicating? Before you put it, try to find out what it means. It will also help you to actually own your presentation. Because if you are talking about that thing, you explain it better to two of us. It will help you to even have a deep understanding of what you researched on. If you researched on a particular topic and you are presenting, and there are some words or phrases you use there, you don't even know what they mean, and you are calling them, that means you don't even know the meaning of what you are saying. Two of us. All right, thank you very much. Thank you very much. Please, your work is okay, but there's room for what improvements. Yeah? So work on these areas I pointed out. So did anybody bother to look up NEDP, what NEDP is all about? Nobody. Please don't limit yourself only to your own work, okay? This is posted in the group. When you are done with your own, don't relax. Try to do what? Do others. Do you know why? These topics, they are what? Yes. So don't just pick your own, because when we are done with this face, we are coming back again. We are coming back again. So if you think that you have a sky, your own is difficult, my own is easy. You read only one, this now, I'm jumping up. No. It will be what? Reshuffled. So use the time you have now. When you are done with your own, try to do others, okay? And get prepared. All right. All right, next person. Obonna Chinwendu favor. Obonna Chinwendu favor. Your question is, write in detail the criteria for selecting essential medicines, essential drugs. All right. The floor is, come closer. Nearer. So we can capture your voice. All right. You can start. Good afternoon.
My question is, write in detail the criteria for selecting essential drugs.
Okay.
According to WHO, they said adoption of a list of essential drugs is a part of a national health policy. This implies that priority is given to achieving the widest possible coverage of the population with drugs of proven efficacy and safety in order to meet the needs of prevention and treatment of the most prevalent diseases.
What are you doing? Are you doing presentation?
Yes.
Please project Let's hear you project. This floor belongs to you. Talk to us. In our good news, ever. Talk to us. Huh? Okay.
1. One of those criteria. Each country should appoint a committee to establish a list of essential drugs. The committee should include individuals competent in the field of clinical medicine, pharmacology, and pharmacy, as well as peripheral health workers, where individuals with assistance from a WHO could be sought. Here they are saying that under the criteria for selecting essential drugs, that 1, every country should appoint a committee to establish the list of these essential drugs, and this committee should include competent people who are skilled in the field of clinical medicines, pharmacology, and pharmacy. 2, drug selection should be based on the results of benefit and safety evaluation obtained in controlled clinical trials and or epidemiological studies. They say that when selecting drugs, it should be based on the benefits the drugs will give. It will be based on the benefits of the drug and the safety evaluation that they have obtained from that drug. 3, the international non-proprietary name, that is generic name for drugs or pharmaceutical substance, should be used whenever available. That means that whenever the drug is available, that the name that will be used is the generic name. So 4, regulations and facilities should be available to ensure that the quality of selected pharmaceutical products meets adequate quality control standards, including stability. Stability means the skill to do a particular job or work. So
Are you done?
yes, sir.
Continue now. Are you afraid with something? I'm starting here. Be yourself. Be
Local
your thing.
health authorities should decide the level expertise required to prescribe single drug or a group of drugs in a therapeutic category. Consideration should also be given to the competence of the personnel to make a correct diagnosis. That means those who are competent in this field, they also make sure they make correct diagnosis. The influence of local disease or conditions on pharmacokinetics and pharmacodynamics parameters should be considered in making the selection. What the drug does, like we all know what pharmacokinetics and pharmacodynamics means. Pharmacokinetics means what the drug does to our body, while pharmacodynamics, also known as post-market surveillance. So,
Is that what is it now?
Pharmacodynamics.
Say it again. What is pharmacokinetics?
I said it is also known as post-market surveillance.
Which one is that?
No, pharmacodynamics. The kind of vigilance.
You are going to debate those. Face the class and talk. You said pharmacodynamics is what?
Okay, pharmacodynamics is the movement of the drug. So they said.
What of pharmacokinetics?
It's what the drug does to the body. What the body does to the
Is that what I taught you in first semester? In second year? Wow.
Pharmacokinetics.
Is what? What the drug does to the body. Anyway, continue your presentation. Continue your presentation.
Which includes like liver disease. These are the things that should be considered. Another one, when several drugs are available for the same indications, select the drug pharmaceutical product and dosage form that provide the highest benefit. They say that when in essential drugs, when several drugs are available for the same indication means people that will take the drug, that are supposed to take the drug. So when several drugs are available for the same indication, that the ones we take are the ones that provide the highest benefits. The one that provide the highest benefit and less adverse effects.
I agree. Continue.
When two or more drugs are equivalent, preference should be given to. I say here in under selecting essential drugs, when two or more drugs are equivalent in almost everything, the following are to be considered. Like the following should be linked to. 1. The drug which has been most thoroughly investigated. We choose based on the drug that has been thoroughly investigated. 2. The drug with the most favorable pharmacokinetic properties. The one that have the most favorable pharmacokinetic property, like minimizing of risks in various states.
In what?
In various states.
Various what? Various states. Which states? Kano State. Continue. I don't want to continue.
Drugs for which local 3. Drugs for which local relief manufacturing facilities for pharmaceutical products exist. Drugs which
last statement is what?
Say drugs for which relief from manufacturing facilities for pharmaceutical products exist.
Drug for which what again? Say sorry.
Drug for which local relief.
Local what?
Local reliable manufacturing facilities for pharmaceutical products exist.
Do you know why? Who can tell us the reason? Read that statement again. Very important in what we've been discussing about essential medicine.
They said drugs for which local reliable manufacturing facilities for pharmaceutical products exist.
Why do you think that is necessary? Any idea? Okay. Thank you very much. Cost effectiveness. Yes. Not flying China, flying to India after incurring all those debt, all those costs. You come back, the local community will what? Suffer it. If you have a reliable plant, reliable whatever you need to make that what medicine locally, why are you jumping up and down going to China and UK to import? At the end, all those planes you bought there, all those costs, is the people in the what, the local people in the game will suffer it. If you can do it here, why importing it? Does it make sense? You said no. Who said no? I said doesn't make sense. You said no. You know where? Yeah, no, continue.
The last one. Drugs, pharmaceutical products, and dosage form which favorable stability or for which storage facility exists.
Of course, that one is true. Continue. Are you done? Continue.
The list should be reviewed at least once yearly and whenever necessary. New drugs should be introduced only if they offer distinct advantage over previous selected drugs. Like in essential medicine, new drugs can only the list of essential medicines should be reviewed at least once yearly, and new drug can only be introduced if they notice that the new one has more advantage than the previous selected medicine.
Are you done? Continue.
The last one. Cost represents a major selection criterion. In cost comparison between drugs, in cost comparison between drugs, the cost of total treatment and not only the unit cost must be considered in addition. The cost of non-pharmaceutical therapeutic modalities should be taken into account. The drug that is most costly.
Throw more light on this your last statement. Throw more light on that. Explain that. Let's understand what you said there. You made a very important point, so explain it so we can understand. Okay,
Costs.
Continue.
I think this place is telling us about effectiveness.
Speak out. Don't speak inside. Speak out. Let's hear you. You're talking about what?
Cost effect. The cost of the drug.
Should do what?
They said the drug of the total treatment.
You're murmuring. Speak out. Let's hear you.
They say in cost comparison between drugs, the cost of the total treatment and not only the unit cost must be considered.
Okay.
In addition, the cost of non-pharmaceutical therapeutic modalities should be taken into account.
What?
Non-pharmaceutical therapeutic modalities should be taken into account.
Are you done? Now, listen carefully. she has great points in her work, but I don't know why she is not in possession of the work. I don't know why. You know what I mean by being in possession of your work? She's not in. This work doesn't belong to her. It's just there, but she has great points there. No confidence, and she was busy dishing out very important point. At a point, she just mixed it up with one thing. I don't know where she got it from. But at the end, majority of what she said here are what? Serious what? Points. So I don't know what happened. Is it not? I'm not the one that did this work. Then why are you acting as if it's not they're not your work? The work is not yours. You speak out. You talk to us. This is what you researched. This is what you digested. This is what you assimilated. Three of us, you ate this thing. You ate it over how many? 1 week, 2 weeks now. Come here, talk to us with all confidence. Talk to us so we can flow with you. Your work, you need to revisit this work. You have a very the point. If you notice that I was busy nodding my head here all this while, she was ditching an important point. But the way she was presenting it as if she don't. Am I even sure that this is it? Let me just say it. She will say one and go back again. She will murmur and come out again and say another one. As if someone else wrote it and gave to her. They were right and give to you. Confess, say the truth. Then why are you presenting it like that? Please, next time work on that, okay? Or even if the work was done by someone else and the person gave it to you, you can still do what? Possess the work. Two of us, yes. You can still do what? Make it your own by the way you do what? You present it. That's the area I wanted to work on. Okay? Good. Thank you. Please, let's encourage her, please. So that last one she mentioned about if you want to consider if you are comparing costs, maybe cost of this particular drug and cost of this one. It's not just maybe the unit cost of the drug you consider. Now, take a look at it holistically. Cost of treatment when using this particular drug for a particular ailment, and cost of this one when using this particular drug for the same ailment. Not just maybe they are selling amoxicillin this amount of money. They are selling this one because of that. Let's assume that there are some drugs that can be used to treat one ailment. This one can treat the same ailment. This one can treat the same ailment. Am I communicating? Something like, let's assume you want to treat typhoid. Generally now you use Cipro. Some will tell you use amoxiclav, augmentin, or let me say amoxicillin plus clavulanate. Some other, this will say talk about using azithromycin. Maybe when you now compare the price, the cost, unit cost of these drugs, maybe some like augmentin may be more expensive. Am I communicating? Now, but if you now, let's assume I'm just painting a reason now. If you now want to use them for treatment, you don't just check the unit cost. Check the duration of treatment. How many times they use the frequency of administration of a drug. There are some that you can just use once daily for like 10 days. That one you may use one daily for like 10 days, maybe more expensive per unit cost. Now, but the one you may use up to 3 times, 4 times a day, for example now, and for like 1 week, and maybe after the first course, you told to do another one again before you can be cleared. Now you see that one you just use 3, 4, 5 days, 7 days as case may be. Even though the unit cost may be more, but when you consider the treatment duration, is cost effective. But if you look at the unit cost, and that's one issue we are having today. How much is this one? They will say 2,000. Hey, that one, you run away. But you go and keep buying that one, you think is cheap. It's cheaper. Maybe use it for like 1 week or 10 days. Use it like 4 times. Because you go and because they give it to you per dose. 1 dose, 2 dose. Some you not even complete it. Then after the thing will come back again. You go back again and continue. But the person that just went straight, bought that particular one for that particular few days, we spend even less than you if you calculate it, everything you spent trying to treat the same what ailment. So that's what they're saying here, that in essential one of the criteria is that when you hear cost, it's not just the unit cost of that drug. They consider the treatment duration, frequency of administration, the total cost of a treatment and total cost of treatment using this one and using this one. Am I communicating? So that's what they consider there. That's the points she couldn't explain. That's why I say she did a nice job. But arrange your work well, okay? Arrange it well, then make it your own. Because in exam hall, for you to write well in exam hall, it should be what your own. True of us, it will come from you, from inside. True of us, because you've read, internalize. From there, you don't synthesize what you do. What right? If you don't internalize, you cannot do what synthesize. So you need to internalize your work. So you can, if you come out here next time, you do a what? A presentation. All right. You are 005, right? Thank you. Let them all right, your question is, what are anticonvulsants? List 10 anticonvulsants in the Nigeria Essential Medicines list. Discuss the pharmacology of any of the anticonvulsants listed above. The floor belongs to you. All right. Good afternoon.
Anticonvulsants may be also known as anti-epileptic drugs or anti-seizure drugs, and is a diverse group of pharmacological agents that is used in treatment of epileptic seizure. Anticonvulsant drugs are also increasingly being used in the treatment of bipolar disorder and borderline personality disorder. That is, it can be used in the treatment of any other changes that occur. Since many seem to act as mood stabilizers and for the treatment of neuropathic pain. Anticonvulsants suppress the excessive rapid firing of neurons during seizures. Anticonvulsants also prevent the seizure within the brain. Then we have Nigerian essential drugs. Phenytoin, carbamazepine.
Sorry, what's that? Say it again.
Phenytoin.
Phenytoin. Carbamazepine. Oh yeah, continue.
Carbamazepine. Primidone.
Primidone, continue, okay. Clonazepam. Okay. Trimetadione. Etosuzimide. Continue. Sodium valproate. Okay.
Diazepam.
What?
Diazepam.
Okay, continue. Turn it. Let me see. Continue, okay.
Gabapentin.
Gabapentin, okay.
Topiramate. Topiramate.
Yes, topiramate, okay.
Then we're going to talk about the traumatic.
Are they up to 10?
Yes, they are 10 in number.
All right, thank you. Okay, continue.
Then we're going to talk about traumatic. Then they're based on anticonvulsant drug. They are good. Then mechanism of action. It depresses the neurons and synapses of the ascending.
Did you hear her? Yes. Continue. Sorry, go back to the mechanism of action again, please.
Mechanism of action. Listen. It depresses the neurons and synapses of the ascending reticular formation of the brainstem.
Neuron and synapses of what? Ascending what? Reticular what? Formation of the brain.
Yes.
Continue.
Reducing the electrical activity of the cerebral cortex and consequently reducing the need for wakefulness and alertness. That is the mechanism of the action.
Okay.
Then dosage form 0.3 to 2 grams daily. The initial dose should be small and increase slowly according to the need and response.
No, there is a misplacement here. That is not dosage form. You are talking about the dosing. Dosage form is what? How they do what? They are presented. So, are they in form of tablets? Is it in form of tablets? Is it suspension? Is it an injection? That was what you mean by dosage form. Did you do that? Did you do? You wrote dosage form, but what you are writing under dosage form is not dosage form. You are writing the dosage. Did you find out whether it's in tablet form, suspension form? So that is what dosage form is. So that place is lacking. So change that into dosage. Just cancel that form. Continue.
Indication.
Then put the form at the side and put question mark after you look it up. Okay. Continue.
Then indication. Petitional epilepsy. That is absence seizure. Then adverse and side effects. The adverse effects are agitated, irritable.
What?
Irritable. Or display other abnormal behavior. That is the adverse effect there. Then side effects, skin rashes, photophobia, sensitive to light. Then contraindications, blood decrease.
Blood what?
Decrease.
What does it mean?
That is
Blood what? Dyscrasias. Okay. So what does it mean? Or dyscrasia, what does it mean? Did you find out? How? In what sense? Damage to the body in what sense? Did you find out? Bone marrow. Who knows this? What she said now? Blood dyscrasia. Who knows? Continue. Look it up now. Those that have data, look it up now. This is how to learn. Look it up now. The spelling. D-Y. Oh yeah.
D-Y-S-C-R-A-S-I-A-S.
D-Y-S, right?
Yes.
C what? R-A-S-I-A-S. Thank you. Continue.
Then I added nursing responsibility.
Talk about it. It's okay.
Give blood forming food. Give food that will form blood to the patient or client.
Why? She said that before you administer, before the patient uses the drug, give something that will do what? Help to form what? Blood. True or false? Why? Why must we do that? These things are linked up. Say, tell us why you must do that. You should do that. Why is it advisable to do that? Why? Look at your work. It's in your work. Tell us why you should do that. She said that in the nursing consideration, that before a patient takes this particular drug, that we should that the nurse should ensure that the patient is also given blood forming. So that the patient will have the strength. What is blood that's craziest? What is it? Huh? Lack of blood. Huh? So nobody has seen it. Huh? Huh? I can get it fast. Talk now, you know him there. Talk. What did you find out? Is what?
Blood dysplasia is considered a non-specific term that can refer to any blood-related disease.
Problem, right? Yes. Good. So it's general. It can be anemia, right? It can be thrombocytopenia. It can be what you call this?
It can be cancerous.
What? Cancerous. It's a problem too on its own. Then, if it may be anyway, the anemia can be megaloblastic or whatever. It can be pernicious, true of us. But the one thing that is a blood issue. True of us, and there are no specific whether it's white blood cell or red blood cell, it's just a blood what issue. Now, I'm not asking her, I not ask her why did she say that you should ensure that the patient takes or given is given maybe blood forming adjunct. Why? That's answering your question now. That's answering your question. So when it is contraindicated, is that not what you said? In patient with what? Look at it now. This work doesn't belong to you, Shay. No?
It belongs to you.
And you're being like this. You said in contraindication, you mentioned what? Blood what? Right? Good. That means it has an issue with what? True of us. Yes. Now, when you are giving, when the patient should also be prepared. True of us. Yes. To ensure that the patient is given what and what that can help in blood formation in case. True of us. Yes. Good, because you know that there's something you mentioned. Was it you or you about risk benefit what ratio? You know that there's no drug that is completely what? Free. That what you consider is what? The ratio of the risk to the what? The benefit. Now, if the risk of the benefit is more than the what? The risk. You give, then manage the what? The risk. True of us. So this trying to give, the drug is important. Then we're trying to give at the same time, ensure that the patient takes what to what? You are managing the risk. True of us. Because the benefit is more than the what? The risk. Am I communicating? Yes. Unless this one is so pronounced that this patient, you don't even go there. You can do what? Leave it and look for other what? Alternative. Okay. Are you done?
No.
Continue.
Then I wrote Regular blood count should be carried out.
Regular blood count. You know why? To check whether it started affecting the what? Okay, continue.
Then, should not be taken with alcohol to avoid serious depression of the central nervous system.
Yes, you know that epilepsy, there is firing. She mentioned it. Firing of where? You mentioned firing. Go back to your work. Firing of what?
Of neurons during sleep.
So this has to do what? Quench it down. So if you are not careful, you need to be careful so that alcohol, if you take it alcohol will even cause further what? Depression of the what? CNS. And it become a problem. True of us. It become a what? A problem. These things, this is how drugs work. You manage. Be careful of this side, be careful of that side. As you use this, you want to understand the pharmacology of any drug, you can manage a patient what, where. Am I communicating? That's why you are doing these things we are doing now. You need to know much about drugs because you may see yourself where you are everything. You are a doctor, you are a pharmacist, you are a nurse. True of us? True of us? Yes. And that life must be what? Saved. So if you're not equipped, you take instead of what? Saving. True of us? So you need to be what? Yes, for remote village you will go. No doctor will agree to come there. True of us? No pharmacist will even agree to even step his or her foot there. True of us? But life there must be what? Saved. So you need to be what? Equipped. You have not seen, you have not even seen PHC. If you've seen PHC, if you go to some part of the country, you see PHC, then you know what PHC is. You put your head there, you will be like, is this what PHC is? You have everything there. You are a pharmacist, you are an accountant, you are the and some staff employed there won't even want to go there at all. They will just disappear. Every month allowed to be entering. True of us?
It's true.
So that's why you need to be what? And by virtue of your you can't leave your patient and go. True of us? You can't try it now. You cannot leave your patient and do what? Go. Alright, so you need to be what? Equipped. So please, this thing I'm doing is not just, I want you to be up and doing. Not just about to sit down and listen and go. No. You need to learn how to research on your own. Learn, get points from different sources. Build yourself. Because it go to a point, it's you that people will come in to ask questions. Because there will be no doctor that they will go to see. Grandmother in the village, before they even go to State General Hospital, it's you that they will come to first. True of us? True of us? All right.
Thank you.
God bless you. Thank you very much. Please, let's encourage her. She tried, but the possession is not that wonderful. But at least she tried. Number what again, please remind me. 0 what? 006. Okay. Okay, next person, Ifeanyi Chukwuchinechere. On ya? Oya puta. Your question is, list and explain the steps for ordering drugs. After that, you explain the steps involved in setting up a drug revolving fund, DRF. The floor is yours. All right. I'll go to class, you can shout Eva. I continue.
Good afternoon, my fellow students.
Good afternoon. Good afternoon.
I will start by defining.
Sorry.
List and explain steps for ordering drugs. What is ordering drugs or drug order? Drug order means a written or electronic order issued by an authorized practitioner. You all know who is an authorized practitioner, right? A doctor or a community health worker, or a verbal order promptly reduced to written for the compounding and dispensing of a drug to be administered to a patient in a facility. That is the explanation of drug ordering. Then the list of steps for ordering drugs. First of all, identifying the patient. Identifying the patient entails comparing the patient's identification on the medication ordered to one in patient profile system. Example, the patient's computer record to make sure they match. Before you give a patient a drug, you must go to the patient's profile and make sure that the name that is being written on the drug that is to be dispensed is on the computer record. Although it may seem like a very elementary task. You know, in a health institution, some people might be feeling reluctant. But it is advised that you check the patient's computer record before you dispense any drug. This importance cannot be overstated, and technicians may pay an appropriate level of attention to this detail, particularly when dealing with a very common name. So it's telling us that when you want to dispense drug, that you should be careful, especially when dealing with common names. In an institutional setting, patient identification number are generally used. Most commonly, patients are identified by two numbers, a unique medical number and an institutional setting. Then number 2, patient identification number are generally used. Most commonly, patients are identified by two numbers, a unique medical record number that distinguishes patients from one another. When you are being admitted in a hospital, you are given a number, and that number is for you. Even if you are siblings or family members, you don't have the same number, so that when drugs are being prescribed or ordered, they can distinguish from each other. An account number that is specific to a transaction or set of transactions, such as an individual hospitalization card. A patient's medical record number never changes. It does not change unless you go to another hospital, then they can issue you another number. But account number changes every time a patient is admitted to an institution. The account number may also be known by other names such as billing number, a financial number, or an administration number. It's telling us that number, that's your card number, does not change. But each time you visit the hospital, the account number that you use in making payments might change. Then the third one is creating, maintaining, and reviewing patient profile. The pharmacy patient profile is a fundamental tool the pharmacy use in receiving order. It is vital that pharmacists and technicians build and review patient profile, which they are processing medical order. This is telling us that whenever a pharmacist is being assigned or wants to administer a drug to a patient, that the pharmacist should review the profile before giving or dispensing the drug. The following information is generally found in the hospital pharmacist patient profile. Although system capabilities may need access to some components. For people that are not using electronic device like a computer, it might limit them from accessing some of the patient profiles. So examples are patient name and identification number. You make sure that the patient that you want to give the drug, that you know the name and the identification number, which is the card number, date of birth or age of the patient, sex, height and weight, lab details, admitting and secondary diagnosis including pregnancy women and lactation status. Before you administer drug, you know whether the patient is pregnant and know the kind of drug that will be administered. Name of admitting and consulting physician, the person that admitted the patient and the physician that consults the patient. Then you know the allergies, the drugs that the patient reacts to, medication history, and so on and so forth. Then other entry steps. The next section will describe the steps involved in entering a medication order into the pharmacy computer system. Selecting the drug product. Once the drug has been compared against the profile, the technician can also proceed with selecting the drug product indicated on the medication order. It is recommended that the prescriber orders drug products by generic name instead of brand name. However, drug products are often prescribed by either or both names, which can result in confusion, abbreviation, although best are sometimes used in ordering medication. Then we have scheduling administration time. The medication administration time can have an impact on drug efficiency. When you want to administer a drug to a patient, you administer the drug on time, not feeling reluctant. You as a health worker, you must be diligent in your work. Then, and other treatment factors such as diagnostic laboratory testing. This impact can be important for some medications. The timing of gentamicin in relation to laboratory tests to measure the amount of drugs calculating in the blood, for example, is important. Its importance might affect the blood level results and subsequent dosing recommendation by the pharmacist or physician. Many drugs should be given at specific time in relation to meals for the best effect. When you want to give your patient drug, make sure that the patient eats well before you administer the drug. Then the number 2 question. Explain steps involved in setting up a drug fund, DRF. 1. Determine the organizational structure, staffing and legal status of drug fund, drug revolving fund. Develop an implementation plan. Determine pricing and exemption policies. Develop the necessary system for pharmacy and financial management. Thank you.
Are you done?
Yes, sir.
Okay. I want to say something on your work. The question says, list and explain the steps for ordering drugs. Ordering. They're not exactly what? The same thing. Medication ordering. Why I didn't stop is because you are dishing some points I want us to do what? Listen to. Okay? So I want you to go back. Do thorough work on steps. By virtue of seeing ordering drugs and DRF, you don't want to be told that they want you to. In that place, how do you now? What step will you take? You want to go and do what? Go and do what? Order for drug, as in, are we together? Getting drugs. Am I communicating? Not really medication order written by a doctor for a pharmacist or to dispense or a order maybe a nurse to administer. No, that one is ordering of drugs. Just as you know, DRF has a lot to do with you order drugs. True of us, drug will come in before you do what? You dispense or administer to what? To patient. So steps in what? Ordering drug. What and what do you consider? What step do you take into ordering what? Drug that you need to use in your what? Facility. That is the area I want you to go. Okay? I didn't stop you because I was enjoying what you are saying. It's also I wanted us to learn one or two things from there. Okay? That's why I didn't stop you. So, but I won't conclude your work now. I want you to go and do research on that aspect. Okay? So you present again. Then this your steps involving what? Setting of drug is shabby. I want you to really at least say one or two things about what DRF is. Then you now come down to talk about. Give us an elaborate work on that. Okay? Okay. So why I'm giving you that chance to go, because you in as much as you did not do exactly what I asked you to do, but at least you didn't talk nonsense. You say something. That's why I want you to go and do what? Do a better job. Okay? In that line. Then elaborate on this. All right. Thank you. Please let's encourage her, please. Okay, now I want to call on the next person. Okay, number 10 has answered. 012. No, 9. Keria. Come out. Victory. 009. Your question: what are anti-allergics? List 10 anti-allergics in the Nigeria Essential Medicines list. Discuss the pharmacology of any of the anti-allergics listed above. The floor is yours. Yeah, welcome. Good evening, welcome.
Good afternoon, class.
Anyone, continue.
Good afternoon, master. Standing on existing protocol is here the one.
Hey, leave her.
Here the one always got to big 009.
Thank you. That's the presentation. That's how to start. Continue.
My own topic is what are anti-allergics? List 10 anti-allergics in the Nigeria Essential Medicine list. Discuss the pharmacology of any of these anti-allergic list above. So, I'll start by defining what is anti-allergic drug. Anti-allergic is also mean antihistamine. They are medication used to treat symptoms of allergies. Such as these symptoms of allergies are what? Fever, conjunctivitis, insect bites. And these anti-allergic or antihistamine are class of drugs commonly used to treat symptoms of allergy. Like I said, if I understand. So here I'm going to list these 10 anti-allergic in the Nigerian Essential.
Sorry, you mentioned what?
Conjunctivitis.
What is conjunctivitis?
It's inflammation of conjunctiva. Sorry.
Where is located?
In the eyes. Yes, in the eyes.
Continue.
10 anti-allergic in the Nigerian Essential Medicine list. We have chlorpheniramine, which is known as Spiritus. We have lolotadine. We have dexamethasone. We have we have adrenaline, we have promethazine, we have hydrocortisone, we have olopatadine, known as patanol. We have okay, it is completed.
See. Bidewa.
Chlorpheniramine.
Chlorpheniramine.
Master, okay, chlorpheniramine. Chlorpheniramine or chlorpheniramine or chlorphenamine.
Loratadine. Oh yeah, continue.
Okay, loratadine, prednisolone,
Okay.
Benadryl, dexamethasone, epinephrine, known as adrenaline, hydrocortisone, methyldiazine, olopatadine, diphenhydramine. It's the same thing. Is the brand name is Benadryl that I called before.
Diphenhydramine. Okay.
Okay, sir.
Promethazine. Stop calling brand name as what you have in the essential list, okay? Call the generic name of the drug. Promethazine, not Phenergan. Promethazine, okay? Continue.
Promethazine and ketotifen.
Ketotifen, continue.
Ketotifen. So, another question given to me here is discussion on the pharmacology of any of these anti-allergic drugs listed above. So, firstly, I'll define what pharmacology means. Pharmacology is a branch of medicine that deals with the study of drugs' action, indication, contraindication, the side effects, and so on. So, the drugs that I will specify on. I have chlorphenamine. Chlorphenamine is anti-allergic drugs or antihistamine used to treat dizzy, itching, watering eyes, and running nose caused by allergies or common cold. So the brand name or nomenclature of this chlorphenamine is Spiritone. So I'll start by the administration of this Spiritone, known as chlorphenamine. The minimum interval between the dosage should be 4 hours. Do not use continuously for more than 2 weeks without consulting a doctor. And it can be given. Let's discuss one. The injection may be given by subcutaneous, intramuscular, or intravenous route. I have what? The dosage of this thing. I have the strength of this chlorphenamine. The strength, we have tablets, we have syrup, we have suspension, and
you are muggling things up here. You said dosage.
Sorry, I have the strength here, the strength of this chlorphenamine. Spiritone, the strength. Sorry. The strength, I have tablets, and under these tablets, I have the strength of this chlorphenamine tablets. Under these tablets, we have 4 mg, 8 mg, and 12 mg. And we have syrup. Under this syrup, we have 5 mg.
So there's not in this class, please.
And suspension. Suspension is given to pediatric only, which is children, and it is 2 mg.
Does it have injection? Chlorphenamine injection?
Yes, because according to my research, they say that it can be given IM.
Are you sure it has injection?
Master, no, I'm not really into this field, but
it doesn't matter. Are you sure it has injection?
It's only the staff.
Find out and tell us in our next class whether it has injection or not. Okay. Find out whether it has injection. Continue.
Okay. So the dosage should be given by the following. Adults, tablets or syrup should be given 4 mg orally every 4 to 6 hours, depending on the I will not say whether 1 or 2. It depends on the weight of the what? Of the patient. So I have pediatric, which is the children. Children.
Is it microgram or milligram? Microgram. What are you writing?
Sir, I wrote according to the research, the thing I downloaded. I saw 2 mcg. But when I was revising my book, I don't know the meaning of this 2 mcg, so I choose 5 ml for syrup. That so I will not be confused in explaining it.
mcg. That should be 2 milligram per 5 ml, not mcg. Anyway, continue.
Okay. So in pediatric, which is the children below 2 years should not be given this chlorpheniramine. Children under 2 to 6 years should be given 1 mg orally every 4 to 6 hours. Children 6 to 12 years should be given 2 mg orally every 4 to 6 hours. While children over 12 years, we have tablet or syrup 4 mg orally every 4 to 6 hours. So, and it will be prescribed according to doctor's prescription. Thank you.
It will be prescribed according to doctor's prescription.
Like if you buy card like 4 mg, I will not tell them the dose because it will be from the pharmacy.
This is to dispense according to the prescription. Which people do dispensing?
Dispense according to doctor's prescription.
Continue.
So I have the common side effects of this chlorpheniramine. I have blurry vision. The person will not be seeing well. I have headache, double vision. The person between double vision, sweating, vomiting, diarrhea, any messes, lack of energy, pain or discomfort when urinating.
Is something missing in that side effect? Is something missing
It's
there?
common side effects.
Is something missing there? What is missing? The chief side effect, she missed it. As in the main thing it is known for worldwide, she missed it. What is that? You missed
It's
it.
here now.
Where is it? Show me.
It's here. It's under the advanced effects.
Continue.
So I have indications. Indications of this pre-tone. We have what? Treatment of acute allergic reaction is indicated for the treatment of various symptoms of allergic reactions such as allergic conjunctivitis, insect bites, skin diseases that are combined by itching such as atopic eczema or by contact. I have contraindication here. People that cannot take this chlorpheniramine, lower respiratory disease, example, asthma, nursing mother, acute asthma, with neonates, like small babies, newborn. Effects of this drug abuse, none. Advanced effects, we have drowsiness, headache, dizziness, abdominal pain, weakness, diarrhea, weight, and urinary retention. So, mechanism of action. Chlorpheniramine is an antihistamine that helps to control the symptoms of cold or allergies, but will not treat the cause of symptoms or speed recovery. It works by blocking the action of histamine, a substance in the body that causes allergic symptoms. So, I have the forms of drugs here. Chlorpheniramine comes in tablets, syrup, Dispension and capsule.
What? Dispension, which one?
Suspension, sorry.
And what?
And capsule.
Remember I said you should find out whether it has what? Find out and tell us.
And I have used this.
This is again what?
Okay, sorry, I'll say this.
Come, say it, let's hear you.
Use it, it relieves let me say what I wrote. It relieves itches associated with chickenpox, insect bites.
You are repeating yourself now. You have already mentioned that. Your work is scattered. Where you should start?
No.
You put it at the back, behind. Why?
It's that first one that I submitted. So, there was some things I didn't put there, so I repeated it and...
Try and arrange it well now. If you're asked for pharmacology of a thing, arrange it well. So the person marking your work will be happy marking your work. True of us. You drive your examiner. That's what I call driving your examiner. That's how you arrange your work. You will be driving your examiner. As the examiner is marking your paper, he will pray for you not to fail anyone, because the hand will do like this. True of us.
Yes.
But that's how you start. You don't just be sighing. Drive your examiner. You didn't drive me well. You should flow. Flow. And I will just be here nodding my head like this. Once you are here and I'm not nodding my head like this, just know that you are not driving me. I should be. So sometimes I'll just close my eyes and be like this. You are driving me. So arrange your work well, okay? All right, thank you. Encourage her now. Wow. It's not easy. Okay. All right, we look at the next person. Who is that?
01.
Number 010 has.
01.
Okay. Zero 1 2. Umeghalo favor kosiso. Umeghalo favor kosiso. I'm coming. I'll give you space to do that. Now, your question. What are antidotes? What are antidotes? List 10 antidotes in Nigeria Essential Medicines List. Discuss the pharmacology of any of the antidotes listed above. The floor is yours.
Good afternoon, everyone.
Good afternoon.
So, my question is, my one is antidotes. What is antidotes? Antidote is a medicine taken or given to counteract a particular poison. Or we can say that antidote is a chemical substance that stops or controls the effect of poisons. Meaning, pronunciation and translation and examples. So, the 10 antidotes in essential Nigerian medicine. So, can I write it on the board?
Call it. Call it. No time. Call it.
1, we have
What?
BCG.
BC. Okay. Continue.
2, we have the Japanese encephalitis vaccine.
3, we have vaccine for COVID-19. Then 4, we have the Abicave. And we have the Abacava. We have the Abacava. Then we have the Abacava lamivudine. Then we have the Abiritone. Then we have the Ancampostrate calcium. Then we have the acetazolamide. We have the acetic acid, and amoxicillin. So listing the pharmacology of any above drugs, I go for BCG. So BCG, which is known as the Bacillus calmette urine, thank you very much, is the live attenuated vaccine from the microbacterium bovis, which is used to prevent tuberculosis and other bacterial infection. So the route of BCG administration, which is given intradermally, the BCG vaccine is being administered intradermally. BCG has been reported to be the most difficult vaccine to administer due to the small size of the newborn arms and the technical nature of the intradermal injection. So the side effects of BCG, we have soreness or discharge where the injection is being given. Then we have high temperature. 3, we have fever or headache. Then we have 4, we have the swollen glands under the armpit in the arm where the injection was given. So the dosage form of BCG is suspension, I think. It's suspension, and BCG is given 0.5 ml. BCG is given the dosage dose for BCG, it is given 0.5 ml. So the dosage so the dosage form of BCG is what? Injection. Thank you all for listening.
You're welcome.
Thank you.
Sorry, you say that BCG is suspension. I'm confused. Suspension, no, injection.
No, like BCG is a vaccine and it's in injection form.
But you say suspension now.
That was a mistake.
Now, let me even understand something. Is BCG an antidote? And you went detail. I was listening to you to tell us how BCG is an antidote, but you didn't say anything about that. And even the drug, all these things you listed, are they antidotes? You said that antidote is a chemical substance that counteract the effect of poisons, and you are listing other things. I don't know where they came from. I'm confused here. In fact, you are confused. Wow. Are you serious? See, I'm going to give you another opportunity. Go back and do your work well. If you come back again and present nonsense again, I'll score you 0. Go back and do your work, please. Don't make a mockery of what you are doing here. Please. Go back and do your work, please. Clap for what? Don't clap anything. Don't make a mockery of what you are doing here. I'm giving final opportunity to go and do your work well. How can you define antidote and you are calling it? I don't understand. I just let me allow you to feel it. Let me even know what you are saying. You messed up by even telling me that BCG is a suspension. What vaccine appears in a suspension from Beacon? You are playing, you are playing. That's so wrong. You wasted about 20 minutes or 30 minutes. You are playing. Please be serious. Go and do your work well, please. Next person, 013 on Nkpor. Good. If not, Grace. The question is, explain in detail the methods used in quantification of drugs. Good afternoon. Answer now. Okay.
First of all, what is drug quantification? Drug quantification is the measurement of quantity of drug. So it can also be the process of determining the amount of selected drug products required. So there are different methods used in drug quantification. I will group it into three. We have the chemical method, the instrumental method, and bioassay. So in chemical method, it's divided into two. We have the gravimetric method and the titration method, that's acid-based titration method. Then in instrumental method, we have the chromatography, that's lipid chromatography. We have the electrophoresis, enzymatic method, and immune method. In bioassays, okay, so let me start with chemical method. Chemical method is the method used for constant analysis with high accuracy. However, it is complicated and time-consuming. Chemical methods include gravimetric method and acid-based titration method. Gravimetric method refers to the separation of the substance or compounds related to the components to be tested, and the contents of the component is determined according to its mass. This chondroitin sulfate and fat content in pancreatic enzyme are both determined by gravimetric method. Then we move to acid-based titration method. Acid-based titration method now is the method. This method is that you have to drop a reagent, that's a reagent solution, with a known accurate concentration into the solution of the tested substance until the chemical reaction is complete. So the main components of main industrial products such as caustic soda, soda ash, aluminium sulfate, and aluminium bicarbonate is generally determined by this acid-based titration method. Then we move over to instrumental method. Instrumental method now, this is the method used for micro and trace analysis with high sensitivity. It includes optical method, electrochemical method, chromatography, electrophoresis, enzymatic method, and immune method. In chromatography is mainly the method used, is frequently method used for it is frequently the method used for drug quantification. It can be coupled with mass spectrometry and UV detection. Spectrometry is the measurement of the wavelength of electromagnetic radiation. So this chromatography, it is like the drug you use to measure is benzodiazepine. It is generally considered among the reference method for benzodiazepine detection and quantification. That's for you to measure the quantity of benzodiazepine drug, you have to use chromatography, as this chromatography. Then chromatography now is the frequent method used to determine benzodiazepine. And benzodiazepine are drugs used for insomnia, anxiety, seizure disorders, and others. Then we have electrophoresis. Electrophoresis is one of the important means of biotechnology and biochemical drug analysis. It has the advantages of high sensitivity, good reproducibility, wide detection range, and simple operation. Do you understand? So we have pH value determination method. pH is the negative logarithm of the hydrogen ion activity in a solution and is used to indicate the acidity of a solution. The device used for pH measurement is called pH meter or activity meter. And this activity meter consists of two parts, a pH battery, a pH measurement battery, and a pH indicator. Thanks.
Clap for her, please. Do you know why I say you should clap for her?
No, sir.
You go far.
Thank you, sir.
Come back here.
Professor.
Do you know why I say she will go far? What she did is not totally out of place, but I want you to bring it home. She went into analytical chemistry. I was even surprised watching her dismantling all these things. Yes, but this is not what you require as what? The extent she went is a wonderful thing. But I want you to go back. I want you to just do more research on quantification of drug with respect to setting of what you are. This is not what you go to where you are working and start talking about chromatography. You don't even have it. Is there any place that they have it there? Just search on something that has to do with how you can quantify drugs in your practice, where you are working, and because that's surrounded. But what you did, he went deep into what actually drug as drug quantification. But you know that in your outline, sometimes drug and medicine and not, there's no clear cut demarcation between drugs and what medicine. So if you go into as for drugs, what drugs actually is, what she said is actually what we on drug. If you go out and Google drug quantification, this is what you see. Because they know what drug is. But I just got what you have in your outline the way it is. There's no clear cut between drug and medicine in your outline. Am I communicating? What you call drug and medicine, actually, if you now go into chemistry, pharmaceutical chemistry, what pharmaceutical chemistry is quite what? The drug is quite different from what? Medicine. So that's what she searched, and that's what she did here. That's why I say she got from her. But I want you to go now. Bring it home to what? Quantifying medicine as quantifying in your everyday practice, okay? Do that one, then maybe you will represent it then before I now give you your score. Okay? Thank you. Clap for you again, please. Any question? Any question? I think we have tried for today. 7 minutes to 3. Okay, we should continue. We should continue. All right, so I think we'll stop here for today so we can go home and rest. And please, I like people that take things seriously. You may not be the most, as I keep saying this, I tell my students this thing. Anywhere I go, I tell my students this thing. The best of the best in a class may not be the most intelligent. The best may not be the most what? It's all about dedication. Dedication and consistency. And not losing focus. Be intentional. That's the watchword. Once you are intentional in what you are doing, you are focused. Avoid distraction. You may not be that one. IQ is gift from God, but gift from God may end up not being used. True of us is you that will now use that gift of God to be able to get to where you should do what. There are many geniuses around on the street now. True of us, maybe they followed the bad gang, bad group of people, and they lost focus. True of us. So that one is just a gift. But what matters is that now that you are here, what are you doing? You may not be the best in terms of that. That one is gift. It's you now. What you? Knowing fully well that somebody else may have that high IQ from God. You yourself know that two of you are not the same thing. That means you put more effort. And if you put more effort, you may even be doing better than that person. True of us, it happens. So it's all about the dedication and take things seriously. There are people that came out here, if you see their work, very organized, neatly organized, good. There are some that came scattered. And as they're delivering their own, everything they're saying is scattered. And if they're not careful, that's how you go to be in exam hall, scattered again. So please, put yourself together, get focused, and take whatever you are doing seriously. So I'll leave you with that, please. At this junction, I will thank you for your attention today, for your time, and I will say God bless you. See you next time.